here with my microphone. Where do you want me? Where do you want me? That's fine. I'm also whatever you want.
Okay, I think we're just about ready. Hello everyone, ladies and gentlemen, distinguished guests. It's great to have you with us this evening for this session organised by the Global Self-Care Federation, the World Health Organization and the International Telecommunication Union. I know it's going to be an absolutely fascinating discussion because it's one of those topics that has the power to transform healthcare and how we look after ourselves. And that is the role of digital innovation in preventing and managing some of the biggest causes of death across the globe, non-communicable diseases. I'm Shuli Ghosh. I'm going to be with you throughout the evening as we look at how digital tools and initiatives like the WHO, ITU, Be Healthy, Be Mobile campaign can really improve access to self-care and empower people who are living with NCDs to effectively monitor and manage their conditions. Now, we have a wonderful panel of speakers. They're going to be sharing their perspectives and their expertise with us. And they're also going to be taking questions from the audience. And I know that this is one of those subjects, digital innovation and tools, that everyone has a lot of questions about. So please have those questions ready. But first, I'm delighted to invite the Director General of the Global Self-Care Federation to start our proceedings tonight. Please welcome Greg Perry.
Thanks, Shuli. And I think you've already encompassed the whole concept of today's, or this evening's event. Yeah. Look, we are at a pivotal moment in NCDs. We know that there's the zero draft for the NCD declaration was issued last week. It's focusing on tobacco, hypertension, obesity, all areas in which self-care, self-management, and indeed digital tools can play a very, very important part. Now, when we talk about self-care, we're not just talking about keeping fit, eating correctly, even washing your teeth. We're talking also about the tools that are necessary for people to self-care. And it's from our industry point of view that the tools, whether these be medicines, whether they be digital aspects, whether they be preventive treatments, are key for self-care. And when we look at prevention and treatment and management, I just want to focus very, very briefly on 3 areas that are related to NCDs. Tobacco-related cancers, gum disease and tooth decay, and skin cancer. Now, these are all pretty important diseases to deal with. Each one of them can be dealt with by simple, straightforward, accessible, and highly impactful self-care tools. One example, of course, is tobacco cessation products. Another is oral health treatments, from brushing your teeth, using fluoride treatments, etc. And then the other point is that they're all available in a pharmacist. So when we look also at OTCs in general, we know that OTCs can provide headroom for primary health care. One figure in the EU is that 50% of all visits to the doctor end up with a prescription for a product that was available over the counter. What does that tell you? A lot of opportunities missed in being able to go directly to the pharmacist and seek treatment. And that's all part of that is required in information, literacy, better understanding. And these are all critical parts of having a very good NCD strategy. Which then brings me to the final point of AI and digital applications. If you add AI and digital applications and what we're going to talk about today, together with the current and future self-care tools which are available and will be available, we're on the verge of almost like a self-care revolution. Because these will be accessible, they'll be self-managed, and they will have very high impact. I leave it at that because the rest is going to be talked about by our distinguished panelists today and our next key speakers. And I thank everybody for coming this evening. Thank you.
Greg, thanks very much indeed. So let's have a look at some of the challenges and put them into context now. And we can hear from Dr. Douglas Betcher, Senior Advisor, Director General's Office at the World Health Organization.
Thanks, and great to see such a good turnout. I know we've got lots of competition for side events right now, so thanks for spending time to come here tonight. And I want to first thank Honorable Minister Latasi from Tuvalu to be with us tonight for our session as well too. Great to see friends, partners, also our longtime partner, International Telecommunication Union and the Self-Care Federation. I keep on wanting to add the medication, but it was recently changed. So for me, this is kind of nostalgic being with you tonight, actually, because it was over 10 years ago. It's kind of back to the future. We were launching for the first time with the International Telecommunication Union, the Be Healthy, Be Mobile initiative, and that really sounded very groundbreaking that time because we were trying to catch the wave of the very fast evolution of the SMS mobile phone technology, with the base case that there were more mobile phones in the world than population, and how we could best use that in lower and middle income countries. And it was a very successful initiative. We managed to reach tens of millions of people to help quit tobacco, manage diabetes, encourage women to be screened for cervical cancer, and encourage people to adopt healthier lifestyles. But now I think we find ourselves very strangely in the last couple of years in what seems to be a really brave new world, brave new reality. And I think it must seem obvious, it seems pretty mind-boggling, the rate of change actually that we've seen with artificial general intelligence is what that means. I mean, certainly a case can be made that this communications revolution is even greater and more mind-boggling than what we've seen in the past. Even some pundits in the know compare this to the 19th century Industrial Revolution. And what must be clear to us, being confronted with these very, very rapid changes, is that we in the public health community cannot be left standing during this digital innovation mass revolution, left standing at the train station when the train's already left the station. And even more so in the area of NCDs, we see that many of the industries, that the health-harming industries we call them, the commercial determinants of health, that already the tobacco industry, other industries are very, very adeptly using these new AGI technologies to mass market their products as well too. So really I think the Be Healthy, Be Mobile, we call it Be Healthy, Be Mobile 2.0, which we've launched in the last year as well too. It's really an opportunity for us to be ahead of the curve, bringing together our resources, our expertise, etc., to really face these challenges head on and make sure we're in the lead and not sort of following on. We also, one silver lining, if we can say that, of COVID-19 was it gave WHO and also the work in this area a head start of adapting AGI technologies to developing chatbots. We developed high-powered, intelligence-powered chatbot assistants. We call, for example, the name Sarah. Her name's Sarah, and she's our 24/7 WHO digital health worker. She's available globally in many different languages. She's already provided access to millions of people, maybe not tens of millions yet, but we want to scale up. As you've heard from Dr. Tedros' speech today, the future of health, he has stated, is digital. But we need, in order to turn that vision into a reality, we need the resources, we need the collaboration, and as mentioned by Greg as well too, we need to move forward, for example, in the immediate future for the high-level meeting on NCDs to make sure that digital health and these technologies have a very strong place in the outcome resolution of the UN General Assembly, heads of state in September, which is starting negotiations in a couple of weeks. And it's obviously, as far as first starters, the business case, compelling investment case for advancing this work is definitely non-communicable diseases and the risk factors. First, because they account for more than 75% of deaths worldwide. We know the burden in lower and middle income countries. We know after the Barbados ministerial meeting a couple of years ago, the challenges also of NCDs to development and economies in small island developing states. But of course also there's the case that at the same time that these conditions are long-term. So they require sustained care and prevention in a very people-centered solution approach. And we already, thanks to our first iteration of Be Healthy, Be Mobile, many of these tools are ready to improve and to advance as well to using these new AI technologies. But at the same time, as I mentioned, we need to do this with utmost urgency because of the commercial determinants of health and the aspect of AGI that can be used in very unethical ways and very unfriendly ways to public health. And in that sense, we need to also look at very concrete and new governance mechanisms. We need the private-public partnerships, absolutely, to have the expertise and the resources and help from the private sector, but we need to make sure that the ethics and the approach of those governance systems are in line with the principles of public health. So we have a great opportunity in the future, and certainly as the HLM4 coming up, definitely NCDs are the crisis of our century. And digital health has to play a part, but we have to make sure that these scale-ups are ethical, that they're equitable and safe for the future. So really looking forward to the conversation as a starting point tonight, and looking forward to very strong collaboration with all of you moving forward. Thank you.
Thank you, Douglas. And I think it's really true of what you say about the pace of change. And one of the ways that we're powering that change is through partnerships. For example, the partnership between the WHO and the ITU. So it's my pleasure now to invite remarks from Simao Campos, Head of Secretariat Focus Group on AI for Health at ITU.
Thank you. Excellencies, Honorable Minister, esteemed partners, colleagues and friends, on behalf of the ITU Secretary General, Ms. Doreen Bogdan-Martin, it's a great honor to be here and welcome you to this important event. Noting that this year ITU is celebrating its 160th anniversary. So we are the oldest international organization, and since 1865, when we started, ITU has not just witnessed, but being an active party to helping shape the most transformative technological shifts in history. You know, starting from the telegraph to telephone to radio communications, digitalization of telecom networks, and then everything that came after, up to today, that we're seeing digital technologies penetrating all sectors and being active, important tools. But few areas reflect this change as powerful as health. So from the earliest telegraphs to today's 5G networks and artificial intelligence that Douglas was talking about, we have technology revolutionizing how we communicate, live, and care for our health. Where we had once care required physical proximity, we can now deliver life-saving information and services instantly, remotely, and directly into the hands of people everywhere. ITU and WHO have a long track history of impactful collaboration. Through the Be Health, Be Mobile that we started 10 years ago with the WHO, ITU has supported governments in using mobile technologies to address NCDs, non-communicable diseases, and to promote health living. But also together with WHO, we have done the Safe Listening Initiative, which is still ongoing and strong, that has produced several technical standards that aim to protect the hearing for all people, in particular the youth. And while they can still enjoy music and video game playing. And this was featured actually on the 160 demonstration. Some of you might have watched it on the ITU Tower, a big projection. They transformed the ITU Tower into a big projection screen and highlighted many of the advances and contributions of ITU. So safety listening was there. As it was AI and the work that we have done in the context of the focus group on AI for Health, together with WHO, where we produced 36 normative guidance documents, and also together with an open code platform that people can use for benchmarking AI-based health solutions. And the idea is to increase confidence, trustworthiness in using AI for the health field. It's an area of growing concern for many people. How can we trust AI-based tools? And we are helping contribute to that. And further than that, we are expanding this platform. The focus group is now closed after 5 years operation. And together with ITU, WHO, but plus WIPO, the World Intellectual Property Organization, that we are launching the Global Initiative on AI for Health for wider adoption of AI technologies in health. So we are really happy to be here and with your presence and discussions we're going to have. We'll be focusing on one particular aspect today on the Be Health, Be Mobile relaunch and how we can use this platform that has been, let's say, from SMS and very basic ICTs used. Today, I think the public is more used to use of ICTs, more advanced terminals and software that can do much more than we did before. So it's a great moment to advance. Used AI in the back of all these technologies to help provide guidance and more targeted influencing for health users and for people to healthcare providers as well, and everyone. So self-care is a big component that can be explored there. So let us seize this moment to scale what works, to innovate where needed, and to ensure that digital health leaves no one behind. And thank you, and wish you a productive, inspiring event.
Thank you very much indeed. So, as we've already heard, digital health, particularly in the health arena, innovation has to be ethical, it has to be equitable. That's going to require leadership and commitment from policymakers. So we are delighted to have with us today the Minister of Health and Social Welfare from Tuvalu to share his perspective. Please welcome His Excellency, the Honourable Tuafafa Latasi.
Esteemed colleagues, partners, ladies and gentlemen, it is my great honor to welcome you all to this very important event on empowering self-care digital innovations for NCD Prevention and Management. Non-communicable diseases such as diabetes, heart disease, and cancer are growing global challenge. In Tuvalu, we face this burden firsthand with lifestyle-related risk factor like poor nutrition, inactivity, and tobacco use contributing to rising rates of NCDs. Limited access to specialized care across our scattered islands add to the challenge. But this challenge also presents us with an opportunity. Digital health solutions are changing the way we approach care, helping us expand access, improve outcomes, and empower individuals to take charge of their own health. Self-care is no longer just an idea. It is a vital part of achieving universal health coverage and the Sustainable Development Goals. Tuvalu is a resilient and close-knit island nation of 9 beautiful atolls in the Pacific Ocean, known for its strong sense of community and committed to sustainable development despite its geographical remoteness. The Tuvalu Telecommunication Corporation, the VACA cable, is set to deliver faster, more reliable digital connectivity, transforming access to essential services. Embracing this digital shift, we have launched mobile health campaigns, SMS reminders, and telemedicine services, bridging the gap between remote island communities and clinical expertise. Additionally, we have introduced an electronic health information system, enhancing data collection, continuity of care, and strategic planning. These initiatives are empowering Tuvaluans with the tools and knowledge to make informed, connected, and healthier choices, strengthening our healthcare system for the future. We recognize that technology alone is not an answer, but when combined with strong partnerships and community engagement, it becomes a powerful tool for change. As initiatives like Be Healthy, Be Mobile continue to grow, we in Tuvalu are committed to working closely with international and regional partners to ensure that digital innovations benefit even the most remote communities. Let us continue this journey together, bridging gaps, sharing knowledge, and empowering people everywhere to take control of their health. Thank you for your commitment, and I wish you a productive and impactful event. Thank you.
Thank you very much indeed. It was good to get your insights there. I'd like now to invite a few comments from Dr. Dimna Kavanagh. She is the Chief Dental Officer at the Department of Health for the Republic of Ireland.
Thank you, everybody, and good afternoon, esteemed colleagues and ladies and gentlemen. And thank you again so much for the opportunity to speak here at this very important event. Because what's special about this event is the focus is on how the public is empowered to achieve their personal best oral health in their daily lives. So in their daily lives, 364 days of the year when they're outside of the dental or the medical clinic. I serve as the Chief Dental Officer at the Irish Department of Health. And while this role differs from big countries, small countries, and otherwise, in general, we advise our health ministries on national policy, but also on global and regional policies as well. And we have a role in particular ensuring that oral health is placed into national and global documents, such as that of the NCD resolutions for the UN NCD high-level meeting this year, and indeed at all of the annual World Health Assembly documents, something I'll return to again in a few moments. But I also serve as chair of the Platform for Better Oral Health in Europe, which is a multi-stakeholder initiative, and it unites advocates from clinical, public health, civil society backgrounds. And together, we aim to ensure that oral health is fully embedded within all EU policies. Well, that's our aim. And at the moment, we have been very successful, it's fair to say, in including oral health into NCD-related strategies, such as the cancer plan, cardiovascular health initiatives, etc. And I wonder how many of you actually realize that oral health has such an impact on cardiovascular disease, diabetes, and many of the general health areas that we're all commonly interested in. And what is really important about me stepping outside of my domestic role along with my colleagues is that EU and indeed global policy shapes our national agendas. So in that sense, it's really important for us all in ministries to lift our heads up and have an influence on those national and on those global and EU policies. The WHO Global Oral Health Action Plan was adopted only just last year at the World Health Assembly. And it's the first time that oral health has its own resolution, its own strategy, and its action plan. And this was a really momentous situation for us in oral health, both for the professionals and I would argue the public, because it reinforces that prevention, not treatment alone, must be the foundation of universal health coverage to include oral health. And this has very much renewed a focus in oral health to empower individuals to care for their oral health at home as part of their overall well-being and quality of life. And so it ensures that when we put in a policy at a government level, or indeed at a global level, that it can be supported at home by people and it can continue on in their daily homes. Because producing a policy that cannot be continued by people and effective by people is just a piece of paper with words written on it. Oral diseases, you may not realize, but it affects 3.7 billion people globally. It shares common risk factors with other NCDs. Tobacco, alcohol, and especially high sugar intake are all of our mutual concerns. And it shares, as I said, an impact with other NCDs such as diabetes, cancer, cardiovascular disease. And it's not just that it shares common risk factors. Oral health, in fact, impacts the severity of cardiovascular disease outcomes, and similarly with diabetes. And so it is not just sharing risk factors, as I said, it is indeed a risk factor itself. We know that periodontal disease in particular independently increases the risk of all of these systemic NCDs by exacerbating inflammation. I also mustn't forget NOMA, which is a non-notifiable tropical disease, and also oral cancer. So while the others affect our morbidity and our quality of life, sometimes we forget that actually oral diseases also cause death and premature mortality. However, one of the areas that's really important for us to emphasize is the growing recognition of oral health's impact on mental health. It's critical and it's notable that mental health and its impact on social conditions is a resolution that was being put forward, in fact, at today's World Health Assembly. So the confidence to smile, to speak, to eat in public directly affects our social participation and employment prospects. And we should follow in mental health footsteps and similarly consider the impact of oral health on our mental health and consequently on our quality of life. I also want to bring your attention to the fact that the pandemic agreement was adopted here today. And again, we know that maintaining oral health in times of crisis and maintaining our resilience in populations is dependent on self-care, since access, particularly to oral care services, are particularly reduced. And finally, I also noted that future nutrition for maternal and child health was also put forward for adoption at the World Health Assembly. And again, this is a policy impacting individuals in their home, such as high sugar as well, which we must all participate and contribute to. While I absolutely have to say, as a dentist myself, oral healthcare professionals play a crucial role, of course, in empowering individuals, but it is outside the clinic where people reside, as I said, for over 300 days in the year, and we must look after them at home. So let's look ahead. The WHO Global Oral Health Action Plan and the recent Bangkok Declaration in Oral Health where we state that there is no health without oral health, have created much needed momentum. But we risk losing it all without sustained, visible leadership globally. We only need amongst us all to see the NCD Zero draft to note that despite all of our advocacy amongst NCD communities, that it remains a real struggle to have NCDs and, for us, oral health included in our member state submissions to the UN and indeed to the World Health Assembly. However, speaking as a ministry advisor, it remains a struggle for us amongst our advisors because many times we are forgotten some of the smaller NCDs, but particularly oral health, which is the greatest global prevalence worldwide. And furthermore, in many countries, the CDO or oral health is perceived as a domestic problem, or in fact, not considered as a problem at all. And so it is really important that we continue to advocate to ensure that it is included in global and regional policies. I would argue that it is the journey from a member state oral health advisor who is entirely committed to having oral health included and other NCDs included in their agendas within their own member state. But when we get into the bureaucracy of translating that into permanent missions and on their journey and into country representatives in New York or otherwise, often oral health and many crucial other NCDs are lost on the way. And we need to get together to understand this pathway so that we can focus our concentrated efforts, our concerted efforts, I should say, so that permanent missions are aware of oral health and NCDs and its significance. And we must consider how we can all work together across governments, ministries, and globally to influence this issue. It is also the work of civil societies to support us as well, and we would welcome that support in ministries and governments. So finally, while the UN high-level meeting on NCDs is approaching in September, as I said, it's crucial that we must continue to amplify NCDs as part, and oral health as part of the global NCD agenda. And down the line, ultimately, this will impact on national policies. But we must remind policymakers that policies require access to prevention tools at home, And it doesn't end with policy alone. We need to empower individuals that are fully supported to care for their own health. We can reduce tobacco and alcohol use, we can improve their diets by our policies and improve accessing vaccinations. But we also need to ensure, as was said earlier, that people feel empowered to access all of these commodities, and especially via this new initiative in relation to mobile digital health. And very finally, as I said, water fluoridation, nutritional policies, including sugar tax, and labelling of alcohol, foods and tobacco are complemented by widespread use of personal care products. While fluoride has always been associated as the go-to active for oral health, it's important that we support innovation and research for other actives. We must also recognise that these products are only effective when used regularly and correctly. So in conclusion, self-care is not a luxury. It is a necessity and a very powerful tool in preventing and managing all our NCDs and enabling policies rooted in prevention to be fully supported and enacted. I would argue that embedding oral health within wider self-care and prevention frameworks, we can truly achieve better outcomes, not just for individuals, but for healthcare systems and societies. However, first and foremost, I would say right now, we must ensure that NCDs and oral health are absolutely included into the UN high-level agreement on NCDs. Thank you.
Dimna, thank you very much, and thank you for those sobering statistics related to oral health, which I think you're right is often overlooked. So thank you very much indeed for that. So we're going to bring this segment of our opening section of our session with some final remarks from Dr. Alarkos Chiesa, the head of the management of NCDs unit at the WHO.
And I'm aware that I'm the sixth speaker before the music really starts. For that reason, I think you will be relieved that I will not use my speaking points, and I will only say why I'm here, and actually the three words that were the essence of my opening remarks. So why I'm here is because I want to welcome you in name of the Department of Non-Communicable Diseases at the World Health Organization. And the reason why it is important for us to welcome you is because the Be Healthy, Be Mobile is hosted in this department, and we are very proud of it. So the three words, that are the essence of my welcoming remarks. The first one is commitment, the second one is impact, and the third one is opportunities. And actually, I was delighted to hear from the Minister of Health, His Excellency, already mentioned two of them. But commitment, why commitment? Because in WHO, we are really committed to use every tool that is available to address NCDs. That is digital health, but it is also self-care, because it's one of the most unutilized mechanisms in health systems today. And really thank you to the Global Self-Care Federation for bringing this important point into our agenda, also the agenda of NCDs. So, commitment, we are committed. The second one is impact. So we have achieved already a lot of impact, 30 million people, 17 countries in 10 years. We need much more of that. So Be Healthy, Be Mobile 2.0 needs to be much more of that. So we need all of us and all partners, all of you who has put really knowledge, passion, commitment into it, we need all of you again and some of you more to really come into the table and bring it forward with us. And the third is opportunity. It has been already mentioned. It's an opportunity, the high-level meeting. Let's use it properly, bringing all these topics together, digital health, non-communicable diseases, and self-care, and make it a reality. But everything will not finish at the high-level meeting is when things start. Please, we need to take that into consideration. Everyone is fixated with September. The important thing is with what comes after. And now let's go to the music and to the real content and more content in this event. Thank you. Thank you.
Right, okay, I'm going to move over here. So this is working, right? You guys can hear me at the back? I have a very loud voice, so I'm not sure if it's on the microphone or just me. And we are going to kick off with our panel discussion now. And as I say, they will be taking questions from the audience. So whatever questions you've got about digital health, please ask. So our first panel, we've got two panels for you today. Our first panel, Empowering Self-Care Digital Innovations from Patient to Provider. Let me introduce our speakers. Louis Lorenko, Community Pharmacist and Professional Secretary of the International Pharmaceutical Federation, FIP. Please come and take a seat next to me, Louis. And we are also delighted to have Hussein Jaffrey, the CEO of the World Patients Alliance. Hussein. No, you can sit on that side. See, I'm saving these seats. Great, guys, great to have you with us. So let us talk about how digital tools then can enhance primary care. We've had a lot of talk about the opportunities and the innovations, and it's exciting, but there's also challenges. So Lewis, let me start with you. Devices, platforms, apps, I mean, there's millions of them. How are they being used to support people in adopting effective self-care routines?
Well, first and foremost, thank you for the kind invitation for FIP to be here, the International Pharmaceutical Federation. And why is that? As you know, that pharmacists are most of the times the first point of contact to when people seek for advice or for some sort of guidance, and that also relates to digital tools. So when you talk about the impact of digital tools on primary health care, we can actually focus on 4 major areas. Prevention or health literacy prevention, then we have the diagnosis and also the management of a chronic disease. So on those 4 points, they have different opportunities. And that comes to the basis of health literacy. Of course, it's important to have access to information. Those digital tools can actually give you some information, but the access for information is not enough. So you actually need to understand that information and incorporate that on your routine. So what's the point of having information about your blood pressure if you don't understand what does it mean, and then to incorporate that. So what we see nowadays is that we do have a lot of access to information, but people rely a lot, mostly on their healthcare partners, healthcare professionals, pharmacists, as we know from our own practices, to understand that information and trying to incorporate that into their routine, because sometimes they can have some information about a certain topic and they are not sure if it's as or is not. Should they notify the side event reaction, for instance? So what you're seeing right now is that people are very eager to know more about their health, but they're also very eager to know more about how to incorporate that into their routine.
But the key thing about these digital tools, though, which I think ordinary people want to know, is that they are evidence-based. We know they work, right?
Yeah. Of course, that's important, and the FIP has set a statement of policy focusing on what is needed to actually see an application or see a device or see a digital tool as reliable to use it on a daily basis. That's true. But again, how can you incorporate that if you don't know what's your status? So there's a difference of knowledge that's important it's a gap that need to be overtaken. So what I would like to emphasize that this is the beginning. What these are, of course, is not the beginning. Then you have starting the second part, but it's the starting point for people to get more involved. It's important to emphasize this because we tend to think that only the access to information is enough, but then what to do with that is relevant. But yes, as long as you keep on following the programs that we have seen now with the partnership with Be Healthy Mobile, actually is giving guidance to national regulatory agencies and Ministry of Health to actually have those tools regulated and to have reliable results. That's important, but then the rest is also relevant.
Hussein, I've done a lot of panels about
AI-based tools and digital tools. And I think one of the things that's really interesting is there is some ambiguity from users as to whether they want to use tools like this. What are patients saying about these self-care applications?
Yeah, I think as we are discussing that the health systems globally, I think they cannot cope up with the burden of NCDs and other chronic conditions. And I think it's the patients who really have to step forward and take up the responsibility and share the burden, as you say, of the health systems. So there are, I think, to help patients, I think these tools and digital health is very, very good, very valuable. And there have been largely very positive outcomes, as was just mentioned. But I think we have to understand which population we are talking about. There's on one hand, we have developed countries, we have higher literacy levels, we have digital savvy sort of people. So they are really getting a lot of benefit out of those digital tools. They are using it, they are giving us very good results. But then you look at the other populations, look at the lower and middle income countries, and the elderly population, people who are not tech savvy, so they are not really, using them.
Yeah, you're talking about my mother. I mean, she's a nurse. She's got high blood pressure. She will not use anything to do with an app or anything to do with digital.
I tell you, even myself, I became pre-diabetic, and I downloaded, an app on my mobile, and it was such a complicated sort of a thing. After a few days, I just and deleted it. So I think it's important. You need to understand your target audience. And then there are some hesitations as well. I think highlight those as well. There are people concerned about the data, the security, who's going to use it, how good the tools are. You never know. You're just getting it on your mobile from any source, and you're not sure how good they are, how comprehensive they are. So I think there are. So what I'm going to say is, it's a mix of both the worlds. People are using it. They are very happy about it. Largely a positive response. But I think there's still a bigger group that needs to be catered for.
Louis Hussein talked about target population. Mm-hmm. How do you ensure that innovation and digital technology and tools are accessible across populations? How do we improve their uptake?
Well, I think it's important to understand that it's a partnership with many stakeholders. Of course, we have the healthcare professionals are there to educate people, to also analyze the data, and to also have some confidence, give some confidence to people to actually using them. But it's important to understand that beforehand. It's important to have it regulated. It is important to know that they are reliable. So the idea of being something effective and in a way equitable, it's important just to go back to the financing part, either through national test systems, to insurance companies, and see that as part of the solution to actually have a healthier population. So equitable, of course, that we tend to, that's oath of the healthcare professionals to provide care in equal manner to everyone. When it comes to technology, and I mentioned that, the issue of downloading, the issue of trust, the issue if you are paying for that or not, it's relevant. So I think it's important to put also on the table that part of the financing. Of course, regulation, but how are you going to finance that in order that everyone will have access to the same tools?
Yeah, I think that's a really interesting point about fostering trust. If we are looking at specifically empowering individuals to look after, monitor their own conditions through mobile health and online platforms, Hussein, how are all these digital devices that we have, the wearables and the AI diagnostics and the little monitors that we can have for our blood pressure, etc., how are they shifting people's behavior towards self-care, or are they shifting people's behavior towards self-care?
Yeah, I think they certainly are shifting behavior. People who are using it, they're shifting behaviors. For example, in diabetes, if you have that app, I didn't use it, but others using it and, using it very effectively. So they wear them, they get those alerts, sort of time to move now, you're not being active, take your medicine, other sort of alerts. So I think they are really making people change their behaviors. But I think there's something more that needs to be done. I think these apps and these tools needs to be integrated into this health system as well. So it's not should be an add-on sort of a thing that I'm doing privately. It should be integrated into my system. So when, as a patient, I know that, my doctor would also ask, look at the data from my app, and
So integrated by your primary healthcare giver.
Yeah, I think it's important. It should not be an extra thing that I'm doing on my own. It should be integrated into the system. The system should look at it, how I'm behaving properly or not. And I think that's the way forward. And as Dr. Douglas just said in the morning, the things are moving so fast. It's so fast. The technology is moving so fast, and I think the technology also the developers also need to understand that they just can't develop a product and bring it to the market. It's the users, it's the providers. I think they also need to be taken into account, and our input should also be there. And while they're developing these products, so that once it is out there, people are happy using it. They're comfortable using it.
Got to be user-friendly and provider-friendly. Lewis, is there a role for pharmacists in this, in training, recommending various devices and apps and training people in how to use them successfully?
Well, yeah, definitely. And we're already doing that with some devices, not have to be specifically digital devices. But there was a point that was mentioned as very important regarding the fact that people are collecting data and that can be relevant for healthcare providers. So what we're seeing right now is that we have a shortage of healthcare professionals worldwide. All the regions actually have a shortages, and we are not perceiving that's going to be a change in the near future. And with the world population increasing, we need to find a balance in order to actually give the right care to people. So if we involve people and enable them to their own care for self-care, even when they're, for example, managing their diabetes, then if the information is shared, if you have a proper algorithm through artificial intelligence, for instance, you have a red flag saying this patient is not controlled, please go to your doctor, please go to your pharmacist. So this idea of all the system being shifted towards people just working as partners, collecting information, sharing that information, I think will be valuable. And of course, if you have questions, again, going back to the pharmacist or to another healthcare provider, and of course, you have a role on that. And on FIP, I've been just putting a lot of effort on enabling pharmacists and national organizations to have their own framework on digital health, and then it can be used by our national organizations to implement nationwide, because we know that things are different, that we still don't have, for instance, I'm speaking of my own country in Portugal, we do have our data collection, but even sometimes public servants and private servants, you do not share the same information. But even the countries don't do that. So there's a long road to actually to go through to have all of this interacted, but we're doing our share as an umbrella organization to give the guidance to our national organizations.
Sharing information is one of those tricky subjects, though, isn't it, that will require some working out. I think something that both of you mentioned was gaps in knowledge. One of the barriers to effective self-care in NCDs in particular is lack of knowledge from patients on how to manage a condition. Their health literacy, if you like. How can digital platforms improve health literacy and make people more aware of what plans they can follow or what steps they can take to improve their mental and physical well-being?
Yeah, I think it's very important that the patients are taken into consideration, and you're talking about. Sorry, I just got blank. So, what was your question?
About improving knowledge. So using.
So I think health literacy, as well as health literacy is concerned, I think it can bridge the gap, to health access. But if it is not put properly, I think it can also create a big divide. So I think that's also needs to be.
I think you said it really well earlier, because you said you actually stopped using an app because A, it was too complicated, and B, it obviously wasn't giving you the support that you felt you needed. And I think that's really key when it comes to digital solutions for self-care, right? Yeah,
that's very important. And I think these tools also need to be culturally sensitive. They need to, understand which audience they are looking at. So a tool developed in America might not be applicable for somebody in Africa or in India. So I think that's also something that needs to be considered. These needs to be into multi-languages also, so not only English, so other languages as well. There needs to be training of both, I believe, providers as well as patients. The providers should also not feel that it is an extra thing that need to do, look at those things, and they need to be clear, and they need to be convinced that it is something good that that needs to be given to patients, and patients also need to understand that this is good for my health. Patient organizations can be taken on board, and they can be the ones who could provide training and education and awareness about these tools. And if there are any misconceptions, those misconceptions can be dealt with as well by patient organizations as well.
This is obviously something that health professionals are going to have to get on board with as well.
Oh, definitely. But I think it's important to share as well that, as I mentioned previously, this is something that it's a path that you're just running. Because at a certain point, imagine if you just think about a certain disease, you're managing one disease, but when you get to more complex patients and we live longer, we become more complex patients, most of the times. What happens is that we have a lot of bias in the information. So I think some that will come up with time. Because it's easier to say, if you have a diabetic patient, then you have this and this information on your application. But then when you add high blood pressure, dyslipidemia, or a mental condition, things will get more complicated. So I think it's important to keep in mind that it's a tool, or that we have tools that are available, but you still need to work it out to see how everything gets together. So it's something that needs to run all of us together.
So one quick question, just to bring this part of the panel to a close. What recommendations or considerations do you think would you want to see to empower the acceleration, or accelerate the empowerment of self-care through digital tools?
Well, I think the first step is to empower self-care per se. Yeah. I think it's important. And then digital comes afterwards. This perspective that we need to give capacity to our patients, either to prevent a disease, either to manage their disease, it's important. And then I think naturally all the digital tools will come afterwards. So I think we can actually put it all together, we can divide it, but also present it together. I think we'll get along very well, because when you just focus on self-care, I think naturally things will come to support also digital tools on self-care.
Yeah, let's hope so. Thank you.
Yeah, and I would say that, bring the patients and providers into the scene, start listening to them, bring them right from the beginning, right from the design stage to the development, so that whatever is designed. And then once there are feedbacks, I think incorporate those feedbacks into the further development of the products. I think that's also very important. I think we also have to deal up with the data privacy issues and the misconception or the hesitation that people have. I think that's also needs to be looked into. Then, I think, as I already mentioned, that we need to involve patients. They are the ones who are going to use it. If they are not on board, it's not going to work in any case. So bring patients on board, bring patient organizations to deliver those trainings, those peer-to-peer counseling, or those online groups where patients are not only made aware, they're educated, and also involve patient organization to do advocacy for this cause. I think all these things, keep them simple as well. I think these are all things that are very important.
All great questions, and I'm sure our digital experts who are about to come on will have all the answers to that. Lewis and Hussein, stay where you are, don't move. And let me introduce our second panel. We're going to talk about catalyzing change, digital self-care in action. Let's bring on our speakers. Debbie Rogers, CEO of Reach Digital Health. Dr. Nandita Murakutla, the Vice President of Behavioural Insights and Evaluation at Vital Strategies. And Ben Carrick, Advocacy Lead for Global Engagement and Public Health at Kenview. Okay, thank you very much. Great to have you with us. So Debbie, let me start with you. We've seen so many digital tools and apps and devices coming onto the market. A lot of them came up during the COVID pandemic, didn't they? What kind of things are exciting? What kind of things are helping with self-care?
I think I feel that the most exciting things are often the simplest. So, we've talked a lot about the different ways that digital can be used. We've got things like portable devices, that's your mobile phone that can help you with behavior change. You can consider overcoming barriers to care. I know you're going to talk a lot about what it actually takes to change behavior rather than just provide information. We've also got the fact that we need to do regular monitoring and continuous management of NCDs. So there are lots of different ways that people can use digital technology. I want to talk about a very specific case. In South Africa, hypertension is one of the biggest problems within pregnancy and drives most of the maternal mortality in the country. And we have a program there called Mom Connect, which is where every mother who comes into the clinic can sign up to receive messaging throughout her pregnancy and up until her baby is 2 years old. She can be, she's given messaging, which is often both information but also behavior change messaging. And she can also ask questions and give feedback to the system. Because hypertension is such a major issue, the National Department of Health wanted to first understand why are people not picking up that mothers are hypertensive. So the first thing that we did was to understand from mothers, to ask them what was their experience at their first antenatal visit. Did they actually have their blood pressure taken? If they had their blood pressure taken, were they told what the results were? If they were told what the results were they put on the right medication? So really to understand that patient journey, understand where the challenges were, and to do this at a national scale. We were then able to introduce training to different health workers based on the data that we discovered, and we were able to drive self-demand for certain services. So we were able to get mothers to go back to their clinic and say, you didn't take my blood pressure last time, I want you to take my blood pressure, or thank you. You didn't put me on the right medication, but I've now been told by Mom Connect that this is the right medication I should be on. So this is a very specific example, but I think it shows you the power of being able to empower people both with information and behavior change communication.
And knowledge, but so they knew what they had to ask for and what they were looking out for.
Exactly.
Yeah, I think that's amazing. Yeah, the microphones, this is new technology in action. But we only have one of them, so we have to share. I'm really interested in the behavioural dimension of self-care. Nandita, I know this is where your expertise is. If we look at the accessibility of health interventions, how does all of this and the kind of digital innovations that we see, how does that change people's behaviour towards self-care? And can we take advantage of that to actually change NCD management through an entire population?
Okay. Well, first of all, there's just no doubt that self-care is essential for addressing and preventing NCDs. And I have to applaud the WHO definition here that integrates empowerment in its definition. In the behavioral sciences, we know that self-efficacy, or this empowerment, having the confidence, the means, the ability to act, is pivotal to behavior change. So it's a really important part of this definition of self-care. The value of digital tools is also indisputable and just unavoidable in today's world, and we're well beyond mobile technologies with AI integration into everything. And there's tremendous value here because with digital technologies, we're able to reach a vast mass of people with targeted information. We're able to push content out, but we're also able to data and insights on what's going on, and then target and refine our interventions in understanding absolutely pivotal. And if you think about all of the medical technologies, this is really an old problem and a new guise. Lots of technologies that have never been used because they've not sufficiently factored in that human dimension. So there's just no way to do this without the behavioral dimension. So what do we know from the behavioral sciences? Essentially, there are two paths by which behavioral change takes place. There is the subliminal, the unintended. This is where the nudges, the cues, all of it influence decision making. And then there's the intentional, what people know, process and then deliberately act on. We can take both of these somewhat simplistic reductions of how behavior change happens and apply it to self-care. At the broadest level, this means setting the context so that the healthy choice is the default. There's just no way to do this without the policy packages, the best buys of WHO that will make healthy choices and self-care possible. So consider this. At Vital Strategies, we have an AI-powered tool that we use to monitor unhealthy marketing online. And we know $16 billion are spent annually on marketing these products, just tobacco, alcohol, sugary drinks. There's just no way digital self-care tools online can fight that force and promote healthy choices until that marketing is stopped. So we need the global packages to be implemented so self-care becomes a default. Then at the level of individuals, even when you take out the noise, this counter pressure for self-care, there's behavioral apathy. There's inertia. We know that long-term risks are just not what people attend to. This is the classical, people worry about plane crashes, they don't worry about road crashes. So how do we change that? How do we get people to care enough to address chronic diseases? Strategic communication, in addition to health literacy, plays an important part here. Triggering risk perceptions. This risk is real, it can happen to me now, and when it does happen to me, will be severe enough, I have to act today. That kind of communication is important. Signals and environments, warning labels, pack warnings, all of these behavioral cues that get people to act, all of that's important to trigger change. And as member states are rolling out digital technologies, there's no need to reinvent the wheel. Civil society partners, others have implemented these strategies, so using what's known would be good. I'll wrap up. I think I'm going too long.
I know. It's really interesting stuff, and I see how it can change and influence how we look, how we approach our own self-care. And I do want to ask you about that a little later on. But I think what I want to do is just skip over to Ben, just so to look at a specific thing, because you mentioned tobacco and unhealthy practices. And Ben, I know that Kenvue's very active in tobacco, the Tobacco Cessation Consortium. As Nandita says, tobacco, one of the biggest risk factors for a host of NCDs. Quitting smoking is possibly one of the best things you can do to improve your own health. How can technology help them do that?
Yeah, thank you. And I won't go over the NCD link with tobacco and things, but it's an incredible thing to do to quit smoking. It's also one of the most challenging. Most smokers really want to quit, but over 75% will fail and relapse to smoking within a week in an unaided quit attempt. So we know that licensed medicines help people quit. We know that behavioural support helps people quit. We know that when you combine them, there's an additive effect. So really, if you can find ways to improve treatment compliance and provide good information, you're going to improve outcomes. So with that in mind, what we did was we took our Nicorette Quick Mist, which is a mouth spray product, and we took an app-based approach. So it's an app that you can personalise to the individual.
And an app,
but it's connected with an NFC chip. So you can connect the two, they're not standalone. So in the simplest terms, smoker downloads the app, they set a profile, put in their own quick goals, so it's flexible to the individual. And then it's as simple as when you use the product, you spray, it's your dose, you tap it, and the NFC chip then registers each use, and that's tracking things in the app about your cravings and your treatment. So it starts to give people a really good way to track how well they're doing in their quit attempt. Now, the app was developed with smokers, I'm pleased to say. We brought smokers in to help do that, so there was some user involvement. It isn't meant to negate the need for the value of healthcare professionals. For those smokers who are getting professional advice, or trained behavioural advice, that's fantastic, but this helps in between. For those who choose not to, it's something additional that they weren't getting. But it's providing motivational tools, it's providing information on how to use the products to improve compliance. It does also generate real-world data, and some of that comes back to us. And that helps us understand smokers better, understand their quitting journey better, It therefore allows us to modify the product, but it also feeds insights into our other work around innovation. And I'm happy to answer questions if there are concerns about which data we do and don't get.
Yeah, and we will talk about data and safety and privacy, but I think data gathering is one of the big strengths of digital apps and innovations. I think, there's a lot of information that we can get that can inform future decisions, but I know it will be one of the questions that people ask.
One of the things I think is important is this is a snapshot of a journey. We've had websites, we've had standalone apps. This is an advance on that, and it's been an improvement. But we know there's a lot more work to do, and it's an NFC chip on on primary packaging of a product. This isn't rocket science. It's not the most cutting-edge technology, but it's been an advance that's helped. It was the first time there'd been an OTC medicine with a connected device. But we're also acutely aware we're not the only people doing things. The Tobacco Cessation Consortium that's been referenced to the WHO, and I know Vinayak's here, is doing great work, and we're very proud to be one of the champions for greater digital work and trying to bring sources together and make that more widely available, including things like the great virtual quitting advisor that WHO created. So there's a lot going on. Happy to partner with others and drive this forward.
There's an app for everything. I mean, clearly the motivation aspect of that is a great help for people trying to quit smoking. So I can see how that would work. And it's clear there are increasing numbers of apps and platforms being developed. Another tool that's just been released by the WHO is a digital kit for self-monitoring blood pressure in pregnancy. I think we have Carl Massino from the WHO in the audience. Carl, do you mind just telling us a little bit about that?
Yeah, sure. Thank you, and thank you to the Global Self-Care Federation for this panel. I mean, I think it's quite incredible to see the diversity of perspectives when we speak to self-care, digital, non-communicable diseases, and here even sexual reproductive health. And it comes a question, are we speaking the same language on self-care? And something that we did at WHO, and it's led by the Digital Health Department in collaboration with different departments, including non-communicable disease and sexual reproductive health, is to define a digital adaptation kit. And the goal is to say, at WHO, one of the core things we do is guidelines, standards of care. But the key challenge we have is how, when we get to the self-care space, when we get to the digital space, how can we make sure that other stakeholders understand what we're doing? Because it's not the same language. And so we developed a product that is called Digital Adaptation Kits that basically translates those WHO recommendations in machine-readable formats. And these include things like, what are the key messages we want to give? What are the key user journey we're looking at? What are the key decision aid that needs to bring as part of the interventions? And I'm really happy to announce that we worked on a specific DAG for self-monitoring blood pressure among a pregnant woman diagnosed with a hypertensive disorder, and that will be released next week. And it's the first time we putting a step in this world and trying to provide standards so as to improve the quality of digital health interventions we have, acknowledging that while as a growing number of technologies, there's also big challenges in ensuring that they're evidence-based in addition to equitable and accessible. Thank you.
Yeah, and I think that standardization and that information is one of the key things. Look, I'm going to hand over to the audience. I just want one quick word, because you've all mentioned it, and I don't mind who answers this question, but how do we engender trust in this new technology? Because we've talked about privacy, we've talked about data, and we've talked about ambiguity by users. Who would like to just say something about how we increase trust? I see your hands up, Hussein, go for it.
Yeah, I think I touched upon this already. I think this is extremely important that we integrate these tools into the health system. Until unless they are not integrated, until unless my doctor is not convinced on the tool that I'm using, it's good. Nobody is going to have that confidence. I think so. We need to work on that line as well. So
you've got to persuade the providers.
No, not only the providers, the systems as well.
We
need to know which is reliable and which is right, and then only we can have in mass terms a good response, a good behavior, as you just put in. So apart from having other distractions or anything, other hesitations, if it is already integrated. If there are somehow the other, maybe, I don't know at what level, but maybe, some sort of a list of maybe reliable tools, maybe, that could be a first step as well.
Maybe regulatory frameworks?
There are thousands of tools available online.
I have a slightly different view. If I can. Oh, thanks. I think the most important thing with trust is providing value to the end user. I think that we approach this very much. So how many of you have used AI in the last month to help you with something in your job? And in the last week? And in the last day? How many of you trust AI? That one's an interesting one, because we know that there are so many trust issues with handing over data, but the reason we use it is because it's valuable to us, so that we value what we get more than we worry about what we're giving. And I think we forget that when we're creating services for end users, we're coming at it from this is the problem that we're trying to solve from a health perspective, and not this is the problem we're trying to solve for the patient. And if we provide enough value, people will trust our services. And I think that's a thing that we need to think about very carefully. That's how commercial digital products are created and why so many of us use them.
There's just one comment I would add here.
Well,
I think whatever
quickly.
you put into AI, you get the result according to your input. If your input is not good, you will not get good results.
Well, I mean, we could have an entire conversation about where AI is getting its data from right now, which is not perfect.
I think the patients can be misled totally if they don't put proper information into AI, they will get wrong results.
Yes. Thank you very much indeed. Right, questions from the audience. Gentleman at the end here on the 1, 2, 3, 4th lineup.
Thank you very much. I'm Raymond Anderson. I'm a history of working in community pharmacy, and I represent the Commonwealth Pharmacists Association. And I've talked, and self-care is one of those topics which is a passion of mine. But I don't see these things as separate. I think between digital, healthcare professionals, and patients and knowledge, it has to work together. I've seen patients who don't want to use digital, I've seen patients who do want to use digital. I've seen patients who don't understand it, but some who trust too much. So for me, this is about supporting self-care, and therefore we need to integrate and have changes in the health systems. And as a community pharmacist, I have experience of working with patients with hypertension in the community pharmacy sector and helping them manage their hypertension with links to the GP records, and in surveys that I've done after carrying out those clinics, the patients were 9 out of 10 supporting. They valued the face-to-face part of the engagement, but at the same time they were being given information, and they also had the tools of hypertension and blood pressure monitoring systems at home. So it's about bringing this all together, but within the health system, as has been well indicated. But I still think that our systems are so rigid that we cannot allow the work of pharmacists to begin to manage and support the management and the support of self-care, because it's still being done at a medical and a GP level. Pharmacists training is very much about medicines, using of medicines, supporting patients with medicines, and I think that has to be better understood and better integrated into the self-care model.
Do you want to comment on that, Lewis?
Oh, definitely. Thank you for the opportunity to actually make some comments. It's relevant, this idea of having the systems that are rigid. We tend to be very open-minded, which is seeing what's the near future or the long future, never know. But the idea that you need to actually put in the table the ones who actually make the decisions and to try to ease the process. Because that's what happens, that we see people working in different velocities. And sometimes when people ask me what's the best approach to implement a change, for instance with digital tools, you think it's national-wide, sometimes the best approach would be like a proof of concept in a community of practice, in a way that everyone gets to know, because it's easier to communicate and then to escalate afterwards, because we can speak about the proof of concept, that's what we are going to do now, but then when you start implementing, there are a lot of roadblocks need to be taken care of. And the fact that we deal a lot with patients as community pharmacists, and we actually have a lot of information as well to share, because this idea of self-care and having access to information is not from now. I remember patients having their records written down of their blood pressure. So what are you going to do with that information?
Thank you. Thank you very much indeed for the comment. Another question from the floor? Right at the back there. Thank you.
Hello, Emma Turnbull from H Advisors. Obviously, we've had a couple of really interesting case studies shared. The first about hypertension during pregnancy, the second around Nicorette, somebody looking to quit smoking. My observation is that during both of these case studies, you're encountering a patient that's already willing to change their behaviour. So you've got somebody who's willing to quit smoking, and then you've got a woman who's pregnant, changes are happening in her body, naturally she's going to be looking around for advice. I suppose my question is around the role of digital where people aren't looking to change their behaviour. Somebody who, how do you get a population to decide, right, instead of going to the GP to get an appointment and then probably be prescribed some paracetamol because I've got a headache, I'm going to walk into the pharmacy and ask the question of what would you recommend, or I have a cold, what would you kind of recommend? And where is the role of digital there? Because that's a system. I suppose it speaks to the gentleman's point just now. That's a system change. That's something different.
That's a great question. Thank you very much. I wonder if that's a behavioural question. So it's a tough one, though, isn't it? Because people who are downloading these apps or using these devices are people who are already on the road to looking after themselves. How do you catch them before they need to do that?
Yeah. I mean, it's a good question, and it's a complex one because it depends on the kind of behavior. So NCDs are so complex that there's primary prevention, and there are several areas within primary prevention where individuals can indeed make those decisions and be brought from what we would call pre-contemplation to contemplation through these sort of strategic, including digital media outreach that gets people to understand their risks, want to change, feel like they have an ability to change, and they come to a point of change. But then there are those other behaviors that will require guided support, or within the NCD spectrum will require management. And that's where I think it's a much more complicated question, where integration within a broader system at its broadest level, at the policy level, at the health system level, at the community level, becomes important.
Thank you. Ben?
So I totally agree. The example with smoking cessation, you've got people who are saying they want to quit. What I would say is the vast majority of people who try, particularly unaided, aren't successful without the right support. So even though you've got someone who thinks they're ready, you still need to give them a lot of support. But I think it's also a really good example of where I don't think necessarily technology is going to be the answer to drive on its own to drive quit attempts. I think that comes down to the broader environment, the policy environment and everything else. It's the smoke-free public places, the tobacco taxation, the advertising control. It's all of those things that will motivate people who smoke to quit, hopefully, or the messages about the impact on a child if it's a young family just being started and things. So you can use technology to perhaps get some of those messages across and things, but I don't think technology will be, in this example, the driver. I think it's other things, and then technology allows people to increase the chance of success. But it's not, that's one example. It's different in other areas.
I mean, you know what? We never know what's coming down the line. That's the thing about technology and digital innovation, because you know, 20 years ago we wouldn't have had this conversation. So maybe there are new things on the horizon which are going to radically change the way we think about care and make us use applications that we don't even know we need right now. So, but there's plenty of opportunities and challenges which are going to come up in the next few years. I'm going to leave it there for the discussion because I think it's been absolutely fascinating. I think we are living in an era where there is going to be a lot of opportunities and particularly a lot of different solutions as to how we look at self-care and how we look after ourselves. I would like you, please give a final round of applause to our fantastic speakers. And I'm going to invite some final thoughts from the organisers of this fantastic panel. Can we please welcome Jodie Van Wyk, the Global Technology Officer for the ITU.
Good evening, everyone. This was really an exciting and forward-looking discussion and energizing us all. Thanks for coming today and coming to hear more about our work from the WHO as well as from the ITU. So we just celebrated our 160th birthday, for those who doesn't know. So we've been at this for quite some time. So if you've been in Geneva over the weekend, you probably saw the light show at our ITU building, which was celebrated by all of us, a very proud moment. Okay, so at the International Telecommunication Union, our work goes beyond connectivity. We aim to build digital foundations that enables healthier lives for all. Through mobile networks, broadband infrastructure, and global standards, we help create an ecosystem where digital health solutions can thrive and reach for those who need them most. Today's discussion reinforced that matter. Diseases such as heart disease, diabetics, cancer, and chronic respiratory conditions are now the leading cause of death globally. While influenced by genetics, environment, and lifestyle, many of these diseases are preventable or manageable by timely and appropriate interventions. These are not just health issues. NCDs are development challenges, undermining productivity, deepening poverty, and widening inequalities. The Sustainable Development Goals recognize this burden and a call for action. Coordinated action to reduce premature mortality and promote well-being for all. Now, digital technologies are transforming how we respond. And we just heard 20 years ago, we wouldn't have had this discussion, right? Mobile apps empower people to make healthier choices. Telemedicine extends to remote communities. Wearable devices track health in real time. AI tools can help predict risk before problems emerge. As we have heard today, these tools are not aspirational. We live them every day. They are in action. WHO and ITU is actively deploying solutions like Sarah, the AI-powered chatbot that shares evidence-based guidance. SMS programs reach millions through Be Healthy, Be Mobile, and tailored digital tools that support behavioral change at scale. That is why ITU is so proud to be leading Be Healthy, Be Mobile. Together we have shown that digital self-care, when grounded in equality, national leadership, and smart technology, can be a powerful force for prevention, empowerment, and resilience. The next 5 years will be pivotal. Be Healthy, Be Mobile is entering a new phase of expansion, welcoming new partners and deepening its reach. Let's seize this opportunity to close the digital divide, to bring closer to communities, and to ensure everybody has the knowledge and the tools to live longer and healthier lives. Thank you once again to the member states for opening the session, to Global Self-Care Federation, all the panelists, and each of you for your energy and vision, your commitment. Let's drive this momentum forward, and I thank you.
Thank you very much. And to bring our session to a close, please welcome Greg Perry, DG of the GSCF.
I think everything's been said. And downstairs, of course, we're going to have a reception. I just want to say two things, really. You got this on your seats. Do read our policy paper on NCDs, and also, very importantly, ahead of the NCD meeting related to NCDs, the high-level declaration, we have an open letter and a call for action, calling upon member states to affirm the importance of self-care and NCDs and to support wording that will create stronger commitment toward self-care interventions. But my final word goes to our moderator, and I'd like you all to give a great round of applause to our moderator. Thank you very much, and enjoy the rest of the evening.
Nice meeting you.
Picture. Sitting. Sure.